Hi friends, my name is Preeti. From today, I'm going to start CNS disorders. Okay, there are many disorders related to CNS like Parkinson's, Alzheimer's, epilepsy, depression, mania, etc. So we'll discuss all of them. Let's start. So first we'll start with epilepsy. Okay, antiepileptics. So what is epilepsy? Epilepsy is nothing but excessive firing of neurotransmitters. Okay. Normally what happens is, see, these are neurons. So this is excitatory neuron, which is glutamate because it involves in the release of glutamate. So it is an excitatory neuron, and this is an inhibitory neuron which releases GABA. Okay. What happens when there is a conduction of impulse through this axonal membrane? There is influx of sodium and calcium ions, and then there is a release of neurotransmitter from the synaptic vesicle into the synapse, and they act on these receptors present on the postsynaptic membrane. Okay, so like this, the excitatory neuron will act, and when there is more excitation, to decrease the excitation, again this GABA, the inhibitory neuron, will act. So there is a decrease in excitation. So there will be a balance between this excitatory and inhibitory neurons in a normal condition. Okay. Whereas in epilepsy, this does not work. Okay. This balance will not happen. Okay. There is a disturbance in this excitatory and inhibitory neurons. Okay. It is because of many conditions, like it can be due to the genetics, or it may be due to the any injury to our brain, or it can be due to the stroke. So in this kind of situations, there will be imbalance between these excitatory and inhibitory neurons. Okay. uh, in that condition, what happens? There will be more excitation than the usual, and there can be a more depression than a usual. Okay. Here what happens is, in a normal condition, when there is a more excitation, GABA is released from the inhibitory neuron, and it acts on the receptor, and then there is a decrease in excitation. After the excitation is decreased, this GABA is again removed from the receptor, and it is reuptaken by the, see here I have written, it is reuptaken by the GABA1 transporter. And then what happens? And then it is degraded by the GABA aminotransferase. That happens. Okay. But in epilepsy condition also, if it happens, then there is a problem for us, because if this GABA is removed from the receptor site, there is even more excitation. So to control that excitation, we need GABA near the receptor site. Okay. Now the drugs we prepare, which we prepare, they should retain the GABA at the receptor site to decrease the excitation. So what are the drugs we take are, first, sodium and calcium blockers. Okay. First target is on a conduction of nerve impulse. So what happens if we block these sodium and calcium channels? There is no entry of these ions into the channel, into the nerve terminal. Then what happens? There is no release of this neurotransmitter into the synapse. Then in that way also we can decrease the excitation. First target. And the second target is glutamate inhibitors. Okay. We can inhibit the release of glutamate into the synapse. That is one target. And the third target is GABA enhancers. Okay. GABA enhancers are nothing but the drugs which block this GABA1 transporter so that the GABA is not reuptaken into the nerve terminal. And also they will block the GABA aminotransferase enzyme so that this enzyme will not degrade the GABA. So these are the targets. So by blocking sodium and calcium blockers, we can balance, we can regulate, control the conduction of nerve impulse, and by blocking the glutamate inhibitors, we can decrease the excitation, and by blocking the GABA enhancers, we can retain the GABA at the receptor site. Okay. This is what happens. So this is my notes actually. So it is very clumsy. Please focus only on this diagram. The side effects we'll study after studying the drugs. Okay. So how to identify epilepsy? Epilepsy, it can be characterized by convulsions where there will be irregular muscle contractions, and also seizures where the condition in which there is a disturbance in the electrical activity in the brain. Okay. Or if a person is suffering with a stroke, he may also have the seizures. Okay. In that conditions, we can say that he is suffering with epilepsy. And the next one is we'll go to drugs. Here the drugs are antiepileptics are classified into 3 types. Okay. The first classification is based on the type of seizure. And the second classification is based on the mechanism of action. And the third classification is based on the structure present in the drug. Okay. Now we'll study about the first classification. So this epilepsy is normally, it is of 2 types, partial or focal seizures and generalized seizures. Okay. Partial or focal means what? Only see, our brain has 2 hemispheres, right and left. In partial, only right, either right or left, only one hemisphere is affected. Okay, only one hemisphere is damaged. Whereas in generalized seizures, both the hemispheres are damaged. Okay, both the hemispheres are affected. So this partial or focal seizures are again divided into three types: simple, complex, and secondary generalized. Okay, simple is nothing but the person who got this type of seizures, they will remain conscious. Okay, but some like eyelashes movements, all that will be irregular, but they will be remaining conscious only. Okay, and under complex seizures, there is a loss of consciousness. Okay, and under secondary generalized, a secondary generalized is a condition in which partial is going to convert into generalized form. Okay, so the drugs which are used to treat these partial and focal seizures are hydantoins, immunostimulants, barbiturates, and aliphatic carboxylic acids like valproic acid, or which is also called as sodium valproate. Okay, these are the drugs which are used to treat partial or focal seizures. And next we'll come to generalized. Generalized is classified into 4 types: tonic-clonic, absence, atonic and myoclonic, and infantile. Okay, the first one, tonic-clonic, is also called as grand mal. So please remember these synonyms. Sometimes they'll ask these synonyms also. Tonic-clonic or grand mal. So tonic means what? The body will be stiff. Due to that stiffness, they may fall back. And also this tonic may lead to clonic, which is nothing but violent muscle contractions and convulsions, which is also called as convulsions. And the drugs used to treat are GABA enhancers, phenyltrypsin, topiramate, jonissamide, felbamate, levetiracetam, carbamazepine, valproate, and phenytoin. And next, absence. Absence seizures or petit mal. Okay, these are seen in children. And these are minors one. Okay. The drugs used are succinides, carboxylic acids, benzodiazepines, phenyltrazines. Under phenyltrazines, we get lamotrigine and lamotrigine. Okay. And valproic acid and antidiuretic, which is acetazolamide. So this is the condition in which there is a loss of consciousness, and after some time they will regain the consciousness. Okay. So here the contraindication is phenytoin. Phenytoin is not given to the children, okay, suffering with absence seizures. Absence seizures are seen in children only, okay, and atonic and myoclonic. Here, first atonic means floppy. It means they fall forward. They will be in a relaxed mode. Okay, so they may fall forward. Whereas here tonic means the body will be very stiff and they may fall back. And here atonic and myoclonic means short muscle stretches. Okay, the contractions are very short. So the drugs used to treat are topiramate, felbamate, carboxylic acid, benzodiazepines, and phenyldiazepines, nothing but lamotrigine. And clonazepam, which is mainly used to treat myoclonic seizures. Okay, and for infantile spasms, also called as hypsarrhythmia. Here we are using carboxylic acids, benzodiazepines, nothing but clonazepam, and prednisolone and vigabatrin. Okay, these are the drugs used to treat infantile spasms. So here I have given some ticks. So these are the common drugs, okay, which are used to treat these three seizures: carboxylic acids, benzodiazepines, and phenyldiazepines. Here also you can see carboxylic acids, benzodiazepines, and phenyldiazepines. Here also same carboxylic acid, benzodiazepines. These are the common drugs used to treat absence seizures, atonic, myoclonic, and infantile spasms. Okay. So this is the classification based on the type of seizures. Remember the type of seizure and also the condition, how the person will behave. Okay. And so now we'll study about the classification based on the mechanism of action. So initially we have seen three drug targets: sodium calcium channel blockers, glutamate inhibitors, and GABA enhancers. So here we can see first one, sodium blockers, carboxylic acid, phenyltrazine, nothing but lamotrigine, and immanostilbene, hydantoin, topiramate, janicimate. Okay, all these they block sodium channels, whereas a T-type calcium channel blockers, valproic acid, johnsamide, succinate, oxazolidines, lamotrigine, and topiramate. Okay, all these block calcium channels. Okay, calcium channels. We have four types of calcium channels: T, L, N, and P. T type are present on CNS and SA node, L heart and blood vessels, N on neurons, and P on Purkinje fibers. So now, as we are studying about CNS, so the drugs obviously they block T-type calcium channels which are present on CNS. So here we can see valproic acid, succinate, oxazolidines, lamotrigine, and topiramate. So no need to remember low voltage and high voltage. Just remember whether they block a sodium channel or a calcium channel. Okay. Next we come to GABA enhancers. So GABA analogs, nothing but gabapentin, GABA agonist, progabide. GABA analog means what? This the drug, it mimics similar to that of GABA. Okay, it acts similar to that of GABA. And next, GABA agonist. Okay, progabide and GABA transaminase inhibitor. So initially we have seen after reuptaking into the synaptic nerve terminal, the GABA is metabolized by GABA transaminase enzyme. So we are inhibiting that enzyme. The drug is vigabatrin, and GABA reuptake inhibitor, which is tigabyne, and then barbiturates, phenobarbital, methobarbital, and primidone. See again why we are using barbiturates. If you go to the receptors video, you'll get that GABA receptor has many binding sites. GABA binding site, barbiturate binding site, benzodiazepine binding site. Okay, so further here there are drugs like barbiturates and benzodiazepines also. Okay, so benzodiazepines are clonazepam and lorazepam and diazepam. Okay, next classification is based on the structure present in the drug. Okay, hydantoins, phenytoin, mephetoin, and ethatoin, oxazolidine. So this is the structure of hydantoin. Okay, and oxazolidine diones, trimethadone, paramethadone, and dimethadone, and then succimides, sensuximide, metsuximide, and ethoximide. So this is a imidazole ring. This is a pyrrole and pyrrole. Okay, heterocyclic rings present, and then immunostilbenes. This is a structure, pyridine and two benzene rings. So they are also called as urea and phenylurea derivatives, or azapine and dibenzazepine. Okay. So the drugs are carbamazepine, phenazimide, okay, and then sulfonamides. Okay, these are calcium carbonic anhydrase inhibitors, sulfonamides. Okay, acetazolamide and ethazolamide. This is the structure. So just remember this main structure. You remember the main ring present in that compound. Okay. And next here I gave a conclusion. Both sodium and calcium channel blockers, valproic acid, lamotrigine, johnsamide, and topiramate. So lamotrigine belongs to the chemical structure phenyltriazine. Phenyl, benzene ring, and triazine. It has 3 nitrogens in it structure. Okay. And then if we come to this here, I have given some primary first line drugs which are used to treat this particular disorder, febrile seizures. Okay, it is nothing but it is mainly seen in children, and in this condition the particular person will have fever. Okay, this febrile seizures can be treated with diazepam. And then status epilepticus, it means infection with fever. It is treated with diazepam and lorazepam. And diabetic neuropathy, it is treated with gabapentin. So pentylene tetrazole induced clonic seizure is treated with ethosuximide. And then trigeminal neural, which is nothing but face. Okay, there will be irregular movements on this face. So it can be treated with carbamazepine. Okay. And also one more point, this topiramate, it is not only a sodium calcium channel blocker, but it also inhibits the excitatory neurotransmitter by blocking the AMPA receptor. Okay, excitatory is nothing but glutamate. It inhibits the glutamate from binding to this AMPA receptor. And then also valproic acid is also a glutamate blocker. Okay. So we have completed the classification of drugs and also with their mechanism of actions. Now we'll study the side effect of some only important drugs. Okay. So here the phenytoin is one of the most important drug. So the side effects of these are hirsutism, yellow discoloring, inhibition of insulin, osteomalacia, neutropenia, and thrombosis, and also Stevens-Johnson syndrome. Okay, which is some skin disease. Okay, Stevens-Johnson syndrome. It can be due to the phenytoin or lamotrigine or carbamazepine. Okay, so these are the side effects of this phenytoin.